Hi, this is Deepa with Allen Pharmacy, and today I wanted to take a little bit of detour from the COVID discussion and talk a little bit about some of the questions that I was getting recently. And I had a lot of patients come up to me and ask, what is an independent pharmacy? They didn't really know much, I'm surprised, and they thought that all we did was compounding. So there were a lot of misconceptions about it. So I thought that this time I would take a few minutes this week and discuss what independent pharmacy really is and what it can offer you and the value that it brings. So independent pharmacies are, this is what they do. They work exactly like any of the major retail chains out there, like CVS or Walgreens or Walmart, and they Rite Aid. There's the same retail chains and brands that everybody's used to and aware of. Independent pharmacies provide the same kind of services, which means that most of them are in network with all your insurance companies. So you would be paying the same copay that you'd be paying at the major chains at your independent pharmacy, sometimes even cheaper. So it's definitely not something that you would pay completely out of pocket for using an independent pharmacy or things like that. So even if your card says CVS Caremark on it, does not necessarily mean that you have to use that company or that pharmacy. You are free to choose, as a patient, you're free to choose whichever pharmacy that you want to. And so I would encourage you to find an independent pharmacy in your area and try to get more information from them about what kind of services they can provide, if they can accept your insurance, if they're not. And what I do for some of my patients, or the ones that have come to us, are, I ask them what medications they're on, and I try to just, do some dummy claims to see if their copay would be the same with us as it is with their current pharmacy. And a lot of times it's actually cheaper. So then before we, actually wind up transferring the prescriptions for them, that's something that we kind of just do for our patients, so that we don't, trouble them or inconvenience them by transferring it back and forth. Independent pharmacies have always been providing free deliveries, at least in their vicinity or in their city that they may be in, depending on the size of the city, of course. But we at Allen Pharmacy provide free delivery in Allen, Texas. And then, we have same-day delivery services available for up to 25 miles, and then which is not free. It has a small increment fee, of course, but we work that out with the patient. One of the main things that we did that I'm super excited to share with everybody is that we can actually now mail prescriptions all over the state of Texas. So that is one exciting thing, and I think a lot of independent pharmacies can do that as well. So those are some of the things that you can be checking with your pharmacies that may be local to you, to see, if they accept your insurance. Would your copay be the same at your current pharmacy and also at the independent pharmacy? And they always, and see if they offer free delivery, or if they mail items for free for you. So those are the three things that I would definitely check with your current independent pharmacy. The reason that we started Allen Pharmacy was the same. We had been going to our same pharmacy that we were going to for 6-8 years. And, when I would go in, I would know the pharmacist, I would know the technician, and I would ask about them and their families, but they never knew who I was. They would always ask me, like, what is your name again? What is your date of birth again? Who are you again? And I just didn't see that connection there, And so when we started this pharmacy, Allen Pharmacy, I wanted to make sure that was not the experience that my community members had. I wanted to be one of those old town pharmacies where the pharmacist knows you, knows your family, knows your grandparents, knows your pets, and that's what we strive to do here. And so this is our little effort. And we look out for them, and we know that they're on some medications, and if we see that those medications are starting to go on back order, we try to make sure we stock it enough so that our patients don't run out. That's the kind of, the treatment, and that's the kind of service that you get when you're working with someone that's at an independent pharmacy. And if you're around the Dallas, Texas area, then we'd love to be of service for you. We're at 972-372-9775. We're open 9 a.m. to 5 p.m. Monday to Friday, and 9 to 12 on Saturdays for now. If we can help you with anything, please think of us. And thank you, and have a happy Friday and happy Mother's Day. Thanks.